October is Breast Cancer Awareness Month, and this month we're working to bring you the stories that can help you navigate this disease. Every Tuesday morning we'll have an interview with an expert who can offer help in the steps after a diagnosis. We begin our series this morning with Dana Neff, who's a certified mastectomy fitter with Boardman Medical Supply. What is the conversation like when somebody comes in for the first time? What kind of questions do they have?
It's usually educational. First thing is, what does my insurance cover? If they've had different types of surgery, it's if I've had reconstruction, do I still qualify if my reconstruction didn't come out great? Or if they just had a partial mastectomy and there's just a little bit of a size difference between the breast tissue, do I still qualify? Those are like the big things. What can I get through my insurance?
What's the next step?
That's the fun part, picking out the absolutely gorgeous bras that we carry, going in, doing the fittings. They always feel relaxed.
How is this going to be different than, say, if they went to Victoria's Secret?
All of our bras have pockets in them that are going to hold those prosthetics so that the women don't have to worry about the prosthetics falling out or moving around or anything like that. They're going to stay perfectly in spot.
Let's talk about the emotional side of this. What's it like?
They come in nervous. They don't know what to expect. It's definitely emotional going into a fitting room with somebody else, having to show myself, their scars, having to show me their scars. They're nervous, sometimes uncomfortable. They don't like to see themselves a lot of time in front of the mirrors. And it's just, coming into terms that, that scar is saving your life. And, from here on out, you're going to hopefully be great and comfortable in what you're wearing.
What is the one thing you want somebody to know if they're nervous about coming in?
That they can take time, that they can come in and talk before we do a fitting. They can call us on the phone if they don't feel comfortable coming in for the first time for a fitting. We're going to take time. They can come in as many times as they need. They can come in and talk to us. They can come in and try some stuff on by themselves.
What can they expect? How close to normal or their old self are they going to see in the mirror after they're done?
Every surgery is different. We're going to get them back to as close to the look that they had before as we can. Everything's going to come down to what happened with the surgery. There's so many different types of surgery. If somebody had bilateral, they can do whatever they want. They can pick, we're going to measure for a band size and they're going to pick the cup size that they want to go with. Somebody with a partial mastectomy, we're just going to fill in the spaces of the tissue that was removed. So we're going to try our hardest to get them back to where they were before.
So again, every Tuesday morning throughout the month of October, Lauren, you're going to share with us one of those discussions that has a lot of helpful information for people who might not know where to turn when they just get that diagnosis. But it's just part of the coverage that we're going to be bringing you throughout the entire month of October. Exactly.
In the evenings on Tuesdays, Erica will have stories at 5 and 6 o'clock. She's going to be sharing survivor stories, but she kicks off her coverage tonight with information about self-breast exams and the things that you need to know to make sure that you're protecting yourself every month and watching out for those lumps. So again, that story tonight at 5 and 6.